Howdy, I'm Aishani Day. From Module 5, I looked at the topic Socioeconomic Disparities in Health in United States. I found that disparities in health are based on two things: socioeconomic status, like income and education, and racial or ethnic differences, like white, black, or Hispanics. This made me ask the question, what is the relationship between socioeconomic status, like income and education, and the health status of various racial groups, and if there is any general pattern? I speculated that people usually below the poverty line are less likely to be educated, so are less healthy, are forced to work in more hazardous conditions, and also have less knowledge to recognize the early symptoms of an illness and other governmental health policies. After doing some research, I came to the conclusion that those at the bottom, the poor and the least educated, generally experience the worst health, but even those with intermediate levels of income and education are less healthy than the wealthiest and the most educated. Now, how is income, education, and health related? In today's knowledge economy, an applicant with more education is more likely to be employed and land a job that provides health-promoting benefits such as health insurance, paid leave, and retirement. Conversely, people with less education are more likely to work in high-risk occupations with few benefits. In 2012, the median wage for college graduates was more than twice that of high school dropouts and more than 1.5 times higher than that of high school graduates. Families with higher incomes can more easily purchase healthy foods, have time to exercise regularly, and pay for health services and transportation. Conversely, the job insecurity, low wages, and lack of assets associated with less education can make individuals and families more vulnerable during hard times, which can lead to poor nutrition, unstable housing, and unmet medical needs. Medical care is one of the resources for health linked with income, which often depends on education. Lack of health insurance can affect health by limiting both access to needed medical care and the ability to pay for other necessities, including food and housing, when serious illness strikes. These two charts shows income and education disparities in child and adult health. The other conclusion that I derived from Braveman's study on socioeconomic disparities is that socioeconomic gradients in health were seen least frequently among Hispanics, perhaps reflecting the Hispanic paradox of good health despite relatively low incomes and educational attainment. The higher life expectancy among Hispanics may also, however, reflect data quality issues, including misclassification of Hispanic names and underreporting of Hispanic deaths. The results for several indicators, including infant mortality and adult life expectancy, for example, revealed that blacks have worse outcomes than do whites at each level of income or education. Blacks may not experience the same health benefits from a given level of income or education as whites. This could potentially be explained by adverse health effects of more concentrated disadvantage, example, far low levels of wealth, and greater likelihood of living in more disadvantaged neighborhoods at a given level of income, or range of experiences related to racial bias that are not captured by routinely collected socioeconomic measures. These findings tell us that most members of our society fail to reach their full health potential, and population-wide social policies are needed to reduce socioeconomic and racial or ethnic disparities in health. Thank you.